I got COVID. Yep, I got it. I got COVID and my whole family. And so I want to share with you today how we have coped with all 7 members of my family getting COVID. Now, I don't really know for sure when I got it because I got 2 false negative tests. Or maybe they weren't false. Maybe I had something else. Who knows? I had 2 false negative tests. And then I finally got my 3rd COVID test, tested positive. And that has officially been 2 weeks today since I got my official positive COVID test. And so I wanted to share with you what my family did to cope with having at least one person testing positive and what we should do. So first thing is, if you are exposed to COVID and you really don't want to get it, there is some evidence that povidone iodine solution in a gargle and in a nasal spray can help to decrease your chance of getting COVID. And so this is 10%, and you would want to use only 1 part of this to 10 parts of water, and then gargle it, and then flush your sinuses with it. Lots of ways you can use. But this is that ugly yellow stuff that they wipe your body with before you're going into surgery to sanitize. And so basically it's just sanitizing where the COVID would be attaching to your mucous membranes in the back of your throat and in your sinus area. So that's one way to prevent it if you have officially been exposed. Now, I'm going to share with you, I have a whole bunch of stuff. I'm going to share with you what I used it for, what symptoms. And what's been really interesting to me is, like I mentioned, there's 7 of us in my family. Every single person had a completely different experience, different symptoms. It has been fascinating. My husband, he's pretty much just lost his sense of taste. He hasn't had to deal with much. My baby, I could not believe the amount of mucus coming out. Like, so much. It was stunning. I've had 5 children, and that was more than I'd ever seen of any child ever. So what the symptoms you have depends on what you should use. So first of all, the number one thing you need to be concerned about is getting pneumonia and having to be hospitalized. And so if that is the case, I highly recommend getting a pulse oximeter. And you just put it on your finger, and it's like what they use at the doctor's office with the red light, and it measures how much oxygen is in your blood. And that is a great surrogate marker to see how well your lungs are doing, whether you need to be hospitalized or not. So if it's staying in the 90s, my doctor said, then you're good. If it's dropping below 90%, then you should definitely call your doctor or go to the emergency room. So that's the first thing. Is I wish I had a pulse oximeter already before my family got COVID. I had to borrow one. So, and then don't get the cheapest one. Get one that has really good reviews. So that was the first thing, is get a pulse oximeter. Next, and this, we mentioned that, I made a humongous batch of elderberry syrup. I know this is like super ugly, but elderberry syrup is wonderful. It has some evidence that it can help with viral infections. And so I would give this to each member of my family at least once a day, and it helped us cope. Next is vitamin C. So vitamin C, 500 milligrams. Some of my kids like the chewables. Some of them would rather just swallow it. And so you can take vitamin C up to 2,000 milligrams. That would be 4 of these in one day. Some say you can take more. I'm not sure about that, but you can at least do 4 of these in one day, spreading them out, because your immune system needs that. And one thing you should avoid, which was really hard for my family, is sugar. And the reason it was hard for my family is because we got COVID Halloween weekend. And so all the neighbors decided to bring all of their Halloween candy to our house to share with my poor kids who didn't get to go trick-or-treating, because we got it literally the day we were supposed to go trick-or-treating. And so your body needs vitamin C to cope, but sugar is directly competing with a vitamin C. So it's best if you decrease the amount of sugar in your diet, especially while you are on prednisone and dealing with COVID. So that's vitamin C. Then I wanted to talk about symptoms. So while you're on prednisone, there are certain things you need to be careful of. And if you get a fever, which many people do, about half of my family members got a fever. So normally I would say you could take ibuprofen, and it helps not only with the fever, but also aches and pains and redness, swelling, inflammation. But it is working in a similar way to prednisone. So you need to be careful with ibuprofen while on prednisone because it's actually a drug interaction. So this is not the best option for people on prednisone and other steroids. Better option is acetaminophen. And acetaminophen is generic for Tylenol. But what's tricky about acetaminophen is it's hiding in a ton of products. So you might get like some combination product that says good for, cold or something. And it might have hidden Tylenol in it, and you don't want to take any extra acetaminophen. And so what you want to do is look at the box and see, okay, does it say acetaminophen here on the active ingredients area? You don't want to double up. You want to stay within the limits. And for most people, that's 4,000 milligrams, which if you're getting the extra strength tablets, that's 8 of these per day. And you can take it every 4 to 6 hours. And so you need to be careful to keep it within the 8 per day and be sure that it's not hiding in any other combination products. So that's acetaminophen is the best choice for fever while on prednisone. You want to stay away from ibuprofen, naproxen, meloxicam, other what they're called NSAIDs, non-steroidal anti-inflammatory drugs, because they do interact with prednisone. And when you have that kind of an interaction, it can lead to ulcers in your stomach that can bleed and you can actually die. That is a definite possibility. So you want to avoid ibuprofen unless your doctor says to take it. So that was fever, aches and pains. I had all of them. I literally had every single symptom. So you can still hear in my voice, I'm congested. I am still congested. I was incredibly congested and I was so red and painful and miserable. So what I did for congestion is 2 different things. So first of all, Sudafed. That's upside down. So pseudoephedrine in the United States, you have to get that behind the counter from the pharmacy directly and show your ID. So if you get Sudafed, I recommend getting the little red ones that are 30 milligrams a piece. And you can take 2 of them every 4 to 6 hours. That's what I've been doing to keep the congestion down because I have been very congested. Then the other kind of congestion I've had is coughing, like deep mucus down there. And so for that kind of cough, you would want what's called an expectorant, and that would be the guaifenesin that is in Mucinex. That helps to, that helps to thin the mucus. That's why it's called Mucinex, because it's helping with the mucus, like helping it thin out. You're supposed to take it with a full glass of water. So I highly recommend drinking lots and lots of water while sick in general, but especially with COVID because it's causing so much mucus. So the first ingredient was the guaifenesin. The second ingredient is dextromethorphan, and dextromethorphan is a cough suppressant. And so if you are having just uncontrollable coughing, at first my coughs were dry coughs and there was no mucus involved. And so plain dextromethorphan would be the best option there. And that would be Delsum. Delsum is is my favorite kind of cough syrup because you only have to take it every 12 hours. And it tastes pretty good. My kids usually like it, but you don't want to give it to children under 6. You have to wait until they're over 6 years old. And so this is the best cough syrup. And yeah, Delsum all the way. Delsum cough syrup. For my younger children, we used the liquid Tylenol, and if you're desperate, you can even use suppositories. So those are some things that we used for cough. And then this is another thing that I need to break it out and use it. It's called a neti pot, and neti pots are really awesome to help with sinus congestion. And so I just need to start using it. I've been so busy taking care of my whole family that I haven't been taking care of myself as much. So this is what I would recommend if you are having nasal congestion like me. I need to take my own advice and do it. It comes with these little packets, and so you dissolve them in water, and then you like pour it into your nose, and then it comes out your other nostril. It's really cool, and it helps to thin that mucus. So that's a really awesome recommendation as well. Let's see. So I think that is the main symptoms that we had to deal with at our house. As far as what you should do to prevent, obviously you should wear masks. If my child's classmates had worn masks, I'm confident that we would not have gotten the COVID. Like, it wouldn't have transmitted, but my child was the only child at school wearing a mask. And so what the vaccine is good for is it's like an umbrella. If you go outside in a normal rainstorm, an umbrella is going to protect you, right? You're not going to get wet. You're not going to be soaked. But if you take an umbrella out into a hurricane, that umbrella can't protect you. You're going to get soaked because of the high volume of water and wind. And right now, for me, at least in my part of the country, it is a hurricane as far as the transmission of COVID. And so the vaccine prevented me from being hospitalized, from dying. It did not prevent the infection. And that is what that masks and social distancing, and when you get infected, staying home and quarantining are good for. They prevent the infection, whereas the vaccine prevents you from getting a terrible complication from the infection. And if you are taking prednisone, this amazing, miraculous drug, and you haven't gotten the vaccine, then you're playing with fire, because prednisone alone increases your risk of pneumonia. And then you throw in the COVID on top of that with your immunosuppression, and your chances of having a worse outcome from COVID, being hospitalized, dying, are higher. And so I highly recommend every person on prednisone get vaccinated. And I often get asked when to get vaccinated. And if you are on prednisone for less than 2 weeks, that's really short term, then wait until you're done taking that prednisone to get the vaccine. If, on the other hand, you are on prednisone longer than 2 weeks, then get the vaccine today. Get it immediately. There's no reason to wait. It's the very most effective at least 2 weeks after your last dose of prednisone, for precision's sake. But if you're going to be on it longer than 2 weeks, just get the vaccine, because you do not want to have to deal with this. These last, it's been 2.5 weeks since my family started this whole process, and it has not been fun. Like, I still haven't recovered my voice. I lost my voice. I've been through a whole lot of misery. And so you want everything on your side when you have that date with COVID, because it's not if, it's when you will be infected. This is like kind of crass, but when you have your date with COVID, do you want to have that big, bad, scary, mean COVID man to like just have his way with you? Or do you want to have a condom in your pocket that you can pull out to protect you? Because that's what the vaccine is. It's protection. Do people get pregnant even with condoms? Yes, it happens. Is it much more rare? Yes, that's what we're talking about. Protection, doing everything, stacking everything in your favor so that you can have the best outcome possible, because it is not if, it is when you will get COVID. So if you have any other questions about symptoms of COVID and the best ways to cope, to prevent them, to like deal with all of these complications, then let me know in the comments below and I can make another video. And then if you are on prednisone and you're worried about your immune system, you're worried about your bones, you're worried about all of the consequences of taking prednisone, then I created a product just for you, and it is called Nutranize Zone. And Nutranize Zone is there to give back the nutrients prednisone is stealing, because prednisone is stealing vitamin C. Prednisone is stealing calcium. Prednisone is stealing at least 9 nutrients. And so if you want to feel better while on prednisone and support your immune system, then get Nutranize Zone at nutranize.com. That's nutranize.com. Signing off as Dr. Megan, your prednisone pharmacist.